On behalf of myself and the rest of the ZS team here tonight, many thanks for allowing us this opportunity to connect with so many members of your network. It's great to see that we're nearly at 80 already. It's amazing. So the objective of this session is to provide you with an introduction to case interviews and share some guidance on how best to approach these interviews, which are a critical element of the consulting recruiting process. Before we get into that, which will be the focus of the presentation, I'll give you a very brief introduction to consulting and ZS and the folks from ZS who are on the line tonight. I promise that won't take more than 5 minutes or so. Then BC will share some insight into what a case interview is, why they're used by so many consulting firms during the recruitment process. And then for the remainder of the session, we'll be talking through an illustrative case, one that we actually used at ZS. We don't use it anymore, otherwise it would be a bad idea to tell everyone the answers. And our objective there, is to help you understand what a case interview involves, the types of questions that are asked, and to share some high-level guidance on how to successfully complete a case interview. Hamid, he'll provide an introduction to the case, and then we'll split into 2 breakout groups to talk through the questions involved in the case. We'll conclude the session with an overview of the ZS application process, and if time allows, a Q&A session. But like Vanessa said at the start, if you do have any questions as we move through the session, don't hesitate to ask them. While we're in this plenary, i.e. we're all together, please put your questions in the chat and we'll answer them as we go. But then when we're in the breakout groups, don't hesitate to speak up. It's meant to be a discussion. The breakout groups are meant to be a discussion, not a monologue from our side. Okay? So let's move on to the next slide. So I'm not going to linger on this because I just learned that I think there was a prior webinar on consulting and the industry and the kind of typical interview process. So I'm not going to belabor this point, but basically, consulting firms, what we do is we help companies solve difficult problems. Problems about strategy. So that's what companies should do, where they should focus, what markets to approach, which products to bring to market, things like that. Management approach, how to run their teams, incentivize teams, motivate people to do what the company wants them to do, and how to structure their organization, and how to do things effectively and efficiently. Okay, so that's operations and execution. So let's go on to the next slide. So a quick introduction to the ZS. Like I said, I'll be very brief. So we're a global expertise-based consulting firm. We've got offices across the US, Europe, and Asia. We're 39 years old, which I find easy to remember because that's the same age that I am. And yeah, we were born out of a university in the US, and we're founded by 2 professors. And since then, we've spread across the US and Europe and Asia. We're focused on healthcare. That represents about 80–90% of our business comes from working with healthcare clients, but we're also building business in other industries, such as technology, travel. Within the company, we have teams focused on key clients. Right, those teams are responsible for mobilizing the best of ZS around those clients. And there are other teams focused on key areas of expertise. Those teams are responsible for ensuring that our offerings remain ahead of the competition. What else to say? I suppose we are passionate about health, and improving patient outcomes. Everything we do really is focused on improving health outcomes of patients. It's about helping companies to invest their R&D budgets in the right areas, addressing the key unmet needs. It's about helping companies to complete their clinical trials quickly, helping them get their products to market and in the hands of patients that need them. So that's what really motivates a lot of us. Okay, so that's it. Let's quickly introduce the people from ZS on the phone tonight. I'll introduce myself and then we'll go around this slide. So yeah, I'm Mark. I'm a partner at ZS, been at ZS since 2005. I lead our business in Cambridge in the UK. I lead our business with a key big client in the UK. And I lead our internal initiative focused on mental health called Healthy Minds with ZS at the end. The intention of that is to make sure we're as good an employer as we possibly can be with regard to the mental health of our people. Okay, I'll pass on to Hamid.
Thank you, Mark. My name is Hamid, and I joined ZS back in August last year, so about exactly a year now. And I'm a SIP associate, so that's Strategy, Insights, and Planning Associate, based out of the London office. And outside of work, I am one of the co-leads for ZS London Book Club. That's something that, you know, we're trying to make active again after a few months of being less active. And well, since Mary is not here, I just wanted to share that Mary is the EU lead for ZS BME. So that's a Black and Minority Ethnic Alliance at ZS. She will be with us soon, but thought to introduce her anyway.
Thanks, Hamid. Hi, everyone. Really excited. There's so many people online. My name's Lucy. I am the EU campus recruiter here at ZS. I celebrated my 1-year anniversary this week, which is super exciting. And yeah, really excited for this evening. Thanks for joining.
Hi, everyone. Hope you can hear me okay. My name is Ola Bisi. You can also call me Bisi. I'm a consultant out of our Zurich office, and I joined ZS last year in February. I'm spending most of my time now working in our research and development practice, mostly focusing on how we can make sure that some of the solutions that we're helping pharma companies to develop are those that are actually useful and required by patients. I'll hand off to Ben now to give a bit of an intro.
Thanks, BC. Hi, everyone. So my name is Dr. Yemi. You can also call me Yemi. I joined ZS in February of this year. And prior to ZS, I've worked at 2 other pharma companies. One was an actual pharma company, the other was a biotech company. And now I am working within the research and development practice area within ZS. Basically trying to use my experience from industry to help ZS provide value adding services and solutions to our clients. I am based out of the London office, and I'm also an associate consultant as Mary.
All right. Now that we've had a bit of an introduction, I guess I can kick us off to the next section. If you could please move us forward. I'll talk a bit about why cases are important, what a case interview process looks like before we jump into an illustrated case and try to figure out some of the things that we could be asked and what the best ways to answer those questions are. Starting off with the next slide. I'm sure a lot of you are wondering what a case interview is, what a case study is. Some of you might have taken part in this, some of you might not have. But overall, imagine that a case interview is a type of job interview that simulates a real life business situation. And the point of this is to allow the companies that are testing candidates to assess how those candidates might perform in a similar setting that's tied to the role that they're being considered for. So case studies tend to be standard parts of the recruitment process for most consulting firms. And what that looks like is the candidate will be presented with a business challenge, which is what a case study is, that are based around real life consulting client projects. Case studies can focus on a wide number of topics. You can be asked about a topic relating to growth, for a company or a product, it can be around pricing and it can be around profitability. For growth, for instance, you could be asked to help figure out a decision or a strategy that can help drive the most growth for a business, with some information obviously provided around what the context is. With pricing, you might be asked to estimate what the best price should be for a product or a service based on what the demand is, based on what the price for other competing products is, and based on the value that the product is expected to deliver. In terms of profitability as well, you might be asked to pick which one is the best among a number of options, or what decision could be made to help improve the profitability of a particular client or company. So that's kind of what the case interview process would look like and what a case study itself is. And then moving on to the next slide. The next question becomes, why is this important? Why do companies do this? Like I mentioned before, case interviews simulate problems, business problems that you could face on a typical day-to-day, especially in a consulting role. And what it therefore does is allow employers to assess candidates on their general quantitative skills. How good are you with manipulating numbers to come up with a decision? How good are you in paying attention to detail, and how accurate are you in getting information out of what's provided to you and synthesizing it into a meaningful recommendation or conclusion? You'll also be tested around your ability to synthesize information and data in a way that allows you to drive business conclusions. And that's one of the things we're going to explore with some of the questions that we'll be answering today. Overall, cases provide a high level of the types of issues that in a consulting role you'd be solving for clients. So it's a good way as a candidate as well to get familiar with that process and even ask interviewers questions around how the process should look like, both during the interview and in a real life scenario. Moving on, there are a number of things to keep in mind when you're getting into the case interview process, and we'll walk through some of these as we begin to answer questions. And the first is just ask questions, get comfortable with asking questions. A lot of information that you might be provided with could be new. You could be unfamiliar with some terms that are used. You might have missed some information that was given to you if it's read out to you, for instance. And you have every right and every opportunity to ask questions to make sure that you're starting off giving answers with the right information and the right context. The second key thing to bear in mind is it's fine to take your time. Don't feel like you need to, as soon as you hear the questions, begin to jump into answering questions. It's highly recommended to stop, review the information you've been given, take some time to gather your thoughts before beginning to answer or attempt to answer the questions. If you need a moment, it's perfectly normal to ask for a moment to gather your thoughts. You won't be penalized for doing that. The third thing to keep in mind is, as you take your time to gather your thoughts, you should very quickly be able to build out a plan around which you're going to answer the question. So for instance, if you're going to be asked to calculate what the potential revenue for a product could be, for instance, when you're given the price and you're given the volume, you should begin to understand that those are two pieces of data that can help you calculate the revenue, and you should plan as such. If you're planning to calculate an item that you feel like you don't have enough information to answer, then it goes back to the first point, which is ask questions so that you're building out a plan that makes sense to begin to answer the questions. The next point is treat case interviews like a discussion with the interviewer. Like I said before, case interviews attempt to simulate a real world environment of having or carrying out typical consulting projects. And usually those involve a lot of co-creation with clients. We would typically have sessions with clients where we're asking them questions about their business, sharing some of our hypotheses and asking for their feedback on how it actually fits into the business. We're experts in a lot of fields, but the clients know their business better than we do. And we should therefore feel comfortable with asking them questions and having conversations with them towards getting the right answer. So it's very important to bear in mind that that's one of the things that you need to demonstrate while you're doing the interview, the ability to talk through your thinking with whoever it is that you're being interviewed by, because it shows how you'll be able to conduct yourself when you're working with a team internally or with the client on projects. And the last thing is be creative when you're answering these questions. There might be a lot of opportunities to bring out things that you've done in other areas into the specific question that you're being asked in ways that help to pass along your message in a way that's interesting to the interviewer and will help you arrive at innovative solutions. So don't be afraid to think outside the box. As you're being presented with data, look out for the obvious data points and information that can help you, but also try to look out for things that are not so obvious, because those could make a difference in the results that you come up with and the recommendations that you end up making. Overall, try not to worry about getting the right answers during this process. It's less about getting the exact correct answer and more about being able to demonstrate how you can think through the process, plan to give coherent answers, and walk the interviewer through your thinking. We'll move on now to look at what a typical case study looks like before we jump into breakout to solve one of the illustrations we've brought in with some example questions. I'll hand over to Hami to take us through the case study, and then we go into breakout rooms.
Thank you so much, Bisi. Okay, so what does a typical case look like? Usually, case information that you have can be categorized into 3 buckets. So the first bucket is basically background information. That's all the data that you're giving up front, basically a prompt that you're supposed to use as a starting point to process and work through the case. That's the first bucket. The second bucket is additional data. And additional data is it varies from case to case. It's very case specific. It can be anything from, population data or demand for a product, market share, sales volumes, any sort of data that basically relevant to the case. So it's just usually separate from the prompts. That's the background information. And then the third bucket has, questions that you're supposed to try to solve. And these questions are of 3 forms. We usually have unstructured questions, which you have open answers, and it's primarily about showing your approach to problem solving and your thinking. We have quantitative questions as well. Those are more analytical. So as a consultant, it's really advantageous to have analytical skills and be comfortable with numbers. So that's another set of questions that we usually have. And the third set of questions are qualitative. And for qualitative questions, 2 things matter. One is that you were paying attention earlier on, so you actually followed through with the story. And then the other thing that matters for qualitative questions is how you communicate, basically. So to recap, basically any case, we usually have these 3 buckets: the background information, some sort of additional data that you're going to use to drive the case, and then specific questions that may be quantitative, qualitative, or unstructured. And if you look towards the right of the screen, we actually left in a sample. We left in a sample, and the aim is not for you to get overwhelmed with all of that data. It's just showing you what a real life scenario might look like, the level of detail in the prompt and the background information, and then the additional data as well. Now I will very quickly walk through this. In a sample case, let's assume that ABC Pharma is a client of ZS, and they're basically trying to launch a new product. And this product they are trying to launch will treat moderate to severe rheumatoid arthritis. Now you can replace rheumatoid arthritis with basically anything. So what you're supposed to focus on here is not all of the details that are on the screen, but the structure of this information. So you can see that we have the market background and the product background. And what we did here was to highlight in green some of the things that would be very useful in solving the case. How does this work? How this usually works is the interviewer will almost basically recite the content here and say, ABC Pharma is the client, this is what's going on in the market, these are additional details on the product, and the interviewee would usually be taking notes, just trying to understand what's most relevant. And the framing, which you see at the bottom, is that you're a member of the consulting team that will support ABC Pharma as they try to launch Rheumatin. So that's the framing. In addition, we usually have, again, back to what I said 2 minutes ago, we have additional data as well. So you can think of this as like clarification data apart from the prompts that will help you in solving the case or driving the case home. And for this particular example, what we have are the results of ZS market research. And this gives us data on efficacy, safety, price, dosing frequency, and things like that of Rheumatin. And the idea is that based off of this data, you are able to develop insights that will help you in solving the case. How do I mean? For example, looking at the efficacy bucket, you can see that in trials, Rheumatin shows a superior efficacy profile versus leading competitors. This sort of data is very noteworthy and is the type of thing you would typically want to remember for later on. Looking at dosing frequency, for example, you can see that patients on Rheumatin usually need to go in once a month and have the doctor administer injections. But on the flip side, some patients actually prefer more frequent, medications, and they prefer to self-administer. And when you think about this, it's just the same way maybe for when you want to do a COVID test or something, sometimes you want to go in to a hospital or a clinic and do the test, but some people have a preference to have a kit and do an at-home test, for example. So this sort of information are the types of data we have available as additional clarification material. And for you as an interviewee, what you need to try to do here is identify what's most important. Recapping across these two slides. So you have the prompt and you have the additional data. If you were in a real life scenario and you have this sort of prompts, you ask for additional data, you have this sort of data, how do you process it is the big question. And some of the things that we think are important for success at ZS and also in general consulting interviews are, one, to always ask clarifying questions. If you ask clarifying questions, you will get more data. And this is really important and noteworthy. So think about it. This is the prompt, but in case you ask more questions, the interviewer has these to give you. So someone who doesn't ask more questions might actually never get access to this and might basically be going through the case without additional information. So that's the first thing. Always ask clarifying questions. The second thing is to stay calm and feel free to ask for time. So this happens sometimes. You just see, a lot of text and like, oh my God, oh my God, oh my God. I know nothing about injections. I know nothing about this sort of therapy. How do I even deal with this? This is standard with case interviews. So it is perfectly fine to say, hey, can I take 1 minute to, process what you have just shared with me and think about the next steps? And again, that is perfectly fine. So an interviewer is always happy for you to take a minute, think through things, and then ask the sorts of questions that will give you more data. Also, while thinking about the data you have, I would say there's 3 things you should look for in the data you have. Look for the obvious, 1. Look for the less obvious, 2. And look for the noteworthy that could drive your hypothesis. What do I mean? In any, data that is shared, either verbally or screen share like this, there's usually a few things that are super obvious that you need to keep in mind. One, for example, is you are a member of the consulting team and you're trying to drive a commercial launch, right? So in one part of your head, you should be thinking, this means we are probably going to do something related to revenue or market size. You shouldn't be thinking things along the lines of, oh, regulating the drug or something else completely. So the things that are very obvious should help you frame, put yourself in the right mind frame. Sometimes there's things that are slightly less obvious that you might not catch the first time. So one good example here is the first bullet after product background, which is that it's a once a month administered therapy, right? Once a month physician administered injection therapy. This is slightly less obvious, but it's important to keep those things in mind as well. And finally, when you're thinking about your hypothesis in, driving the case and solving the case, it's always good to look for noteworthy information. So looking here right at the bottom, market summary, for example, one thing that is particularly noteworthy is that overall, doctors are satisfied with treatment options today, but care a lot about efficacy. They would like to see better efficacy. So that is something to keep in mind as you think about putting together your hypothesis or, solving the case. So now that's everything that is important from a prompt and additional information perspective. And now we can go into breakout rooms. I know Vanessa is trying to set those up in the background, but just to let you know, we will have 2 groups randomly assigned. So, and then each group has teams of ZSs we're going to facilitate, and we are going to simulate what a case interview looks like along with you. As you come into the breakout rooms, please wear your consulting hats. So basically, remember some of the things I said earlier, unstructured questions will come. So thinking about something from where you have no prompt perspective, qualitative questions will come where some of the data we have just shared, you have to find answers to them. And what's important is, how you communicate them. And quantitative questions will come, which mean that you probably need to have a pen and a paper to figure out an approach to some of them.
We won't focus on what the answer is, rather we'll focus on some tips and tricks or some guidance or advice on how to approach these different types of questions, okay? And if you have questions at any point, please don't hesitate to speak up, okay?
So I'm just going to share the slide. Can you see my screen?
Yep.
Yes. Yeah.
Okay.
All right, so in this interview, the interviewer would, oh, Yemi, we can now see your notes, your presenter mode. There we go.
There we go.
This is fine. Yeah, so in this interview, the interviewer would would provide the 2 slides we've just reviewed and then pose the question, what are some potential hypotheses you have for reasons to prescribe rheumatin or not? And then they'd go quiet and say, wait for the candidate to respond. So I'll kick this off in terms of sort of tips and tricks, like unless someone wants to share their perspectives. It's not much to it, really. The key here is about sort of connecting different pieces of information that you've been provided, right? So on the prior slide, on the context slide, there was details about the market. And on this slide, there's other details about the market and what drives decision-making by customers. And it's that joining the dots across the content that's really focused on at this point. So joining the dots, thinking about summarizing all the things you've been told. Some other things to repeat, some tips that Hamid and Bissi shared earlier. If there's something on this content that you don't understand, definitely don't hesitate to ask a question, right? I've done 1,000 interviews, and it's really awkward when the candidate doesn't ask something, and so clearly doesn't understand something, and then you go through the entire interview without them understanding something, and it's just super awkward. So definitely don't hesitate to ask questions. And also, in a situation like this, you know, as the candidate, you've just been given a whole load of information. There's no possible way on earth that anyone can understand everything that they've just been told instantaneously. That's impossible. And so no one would expect the candidate to quickly start answering the question without taking some time to process all the information that's been shared. Okay, that's just some initial thoughts. Temi and Kiva, I saw you had questions. Feel free to unmute yourself.
Hello, can you guys hear me?
Yeah.
Yeah. So actually mine was not more of a question, but kind of based on this question that you provided, the hypothesis for opportunities and barriers to prescribe this. So based on this, I saw the efficacy it showed superior efficacy. So automatically the opportunity looks great for it to be priced competitively. And then it says that it's more expensive than competitor brands. So basically you want to maybe, I don't know if we would ask in terms of what do we have information about what the competitors' price is, because obviously we want to recoup our cost. So we need to price it more than what they have. And I think it was either this slide or one of the other ones we talked about. It says that the physicians they like to see better efficacy in the market. But if we are in phase 3 trials, I would assume that, you know, we have safety data that shows that this is a safe product. So we can probably convince the physicians that this product is good for their patients.
Great.
So those are opportunities.
Yeah, they're great. They're exactly the sort of things that the interviewer would hope people to mention. Yeah, more efficacious. There could be some issues regarding to price if it's more expensive, because that's not a good thing for physicians or patients. But then, yeah, great stuff. Any other thoughts on drivers or barriers to using this product? Kiva, I think your hand went up next.
Good afternoon. A barrier, they were discussing cardiac issues. So that should be some concern. They weren't specific with it, so they will need to specify exactly what cardiac concerns that they were speaking about. So that will be a barrier as to why, you know, the product may not go forward.
Great. That's another good one. I'll take maybe one more comment before we move on. I think there's not going to be enough time to take all comments on every slide, otherwise we won't get through every question. Priscilla, I think you were next.
Just looking at opportunity, I know we mentioned that price could be a potential barrier, but looking at the decision-making process of physicians, price didn't seem to be at the top of the list. So efficacy was a real sort of like deciding factor for them, which we know is superior in. So that just presents a great opportunity. But I did think a barrier could be the in-clinic appointments and the frequency of administering. Just because it seems like there's a preference there for people to be able to have more autonomy over that and do it at home.
That's a great one, right? If you're a patient, you don't want to travel into the office to get your medication every month or so. It'd be much more practical to be able to do it at home. Thank you. Hey, Yemi, any other thoughts from you before we go to the next question, or did we cover the key bits of advice?
No, I think we've covered pretty much all of it for now. Yeah.
Fabulous. All right, sorry, George, Chejashri, or Rebecca, if you have maybe questions, feel free to put them in the chat. We'll try to answer them as we go along. Otherwise, we're gonna have to crack on, okay?
I just had a question.
Yeah.
Regarding solving the case. So do you start first with identifying the objective? Because I thought maybe they wanted to launch this particular product. So what is the main objective of the case? What are we really trying to solve? Do you get that clarification first before solving the problem?
Oh, absolutely. Great point. If there is any uncertainty about the context that you're provided to a case, and it's not clear about where the customer is or what their key problems are, or what their overall objective is, then absolutely clarifying questions. Yes, absolutely. That's a great point, George. If there's any uncertainty, ask questions. That's always good. Okay, let's move on. So the next question in this case it's less qualitative, it's a bit quantitative, but it's quite unstructured, right? So in this situation, having had a conversation about the product and getting comfortable with the case, the interviewer would then ask, how would you go about calculating the market opportunity for rheumatin? And again, they would then go quiet and wait for the candidate to either try to start answering the question or to ask clarifying questions. All right, so in this case, maybe let's take some comments on thoughts on how to approach the problem, and then we can get into sharing our thoughts on the frameworks to employ or how to respond. George, is your hand still up from the last time, or you got an opinion, or is it Temi again?
Sorry, can you hear me? Yes.
You got it. Yeah.
Actually, I think maybe a clarifying question might be, we're launching this product, where specifically? Is it just in one country, or is it like globally? Like, what? I don't know.
Great.
Where.
Yeah, great question. So let's assume we're in the US. Assume we're in the US. Yeah.
Okay. Yeah. Then I would say, how many people are diagnosed with this particular disease? And then go from, okay, how many people are diagnosed with the disease, and how frequently do they take the medications? And then maybe look into the pricing, like or I guess doctor visits, not the how many, because doctor visits is when they actually have to get the injection. And then basically calculate on that what the price would be, and then, okay, you can do that kind of price by patient visits.
Nice, fabulous. Yeah, that's exactly the right way. This is a classic kind of market sizing kind of problem, right? And so, the key part of this is about, introducing some structure and starting from big numbers to small numbers, right? It's a big funnel to try and work out the answer. And this kind of question is not about actually working out the numerical answer, rather thinking through a structure in which to approach the problem, right? So, for example, you might start by thinking, well, you need to work out what is the market size, right? So what is the total number of patients treated for rheumatoid arthritis? And then you might think, okay, well, let's work that out. And then let's think about, well, what share of those patients will we get on our product? And then you think about, well, how do we convert those patients into revenue, right? So there's like 3 macro buckets. And then you might start saying things like, okay, well, if we could work out the population of the US. Then we could think through, what percentage of those have rheumatoid arthritis, narrow it down and think, well, what percent of those are actually taking, have moderate to severe rheumatoid arthritis where this product is indicated, and so narrow down further. What percent are actually diagnosed and treated? Narrowing it down to get to this view of, well, what is the total number of treated patients? And then it's about thinking, okay, well, of those, what percentage could be on Rheumatin? And then, like you said, Temi and others, thinking through, well, if you have that many taking the product roughly, then, how many doses does that represent in a year? And so you think, well, how many doses per year? Like, how long do they stay on treatment, price per dose, all of that thing, to get right down to the number. So, oh gosh, 6 more minutes before breakouts close. Right, we need to hurry up.
Okay.
So, Yemi, before we close, any other thoughts on this one?
Just to add that, as you build out your approach and go through that funnel that you were talking about, Mark, if you are making any assumptions along the way, to keep calling it out so that, whoever is listening to you can follow your thought process.
Fabulous.
Okay.
Adima, I see a hand up. Is that a question before we move on?
Yeah, I have a question. In the previous slide, we kind of compared the pricing. We compared the pricing to other competitors, but when you were discussing the funnel, you didn't mention where the competition comes in. So wouldn't it be a good idea to ask what's the competition like? Then we now decide, okay, so how do we spread, how much of the competition can we take? How much from the competition can we take?
Yeah, absolutely. Great one, Adima. Yeah, so absolutely, competition is key, right? You need to understand what's the competitive landscape and how we compare versus the competition. And typically you take that into consideration when you're moving from the market size to product share. You're thinking, well, what share of the market do we realize for our product, when you compare the strengths and weaknesses of our product versus the others, and that might include, access considerations or pricing or efficacy or safety or anything else. But absolutely. All right, so I want to make sure we cover this next question, because this is now a different type of question, right? It's a quantitative question. So having talked through the approach on the prior slide with the candidate, the interviewer would then say, okay, great, well, now let's work it out. What do you think, the total market revenue, what is the opportunity size for this population, for this product in the US? And again, they'd go quiet, and it would sort of, either the candidate would say, well, give me a minute, I want to collect my thoughts, or ask any clarifying questions, but typically good to take a few minutes or a minute or so to think things through, make a few notes on the paper, and come up with a view on how to work this out. So in the interview, the candidate would be provided with the content on the left, some of these data points like prevalence of the disease, percent of patients that are diagnosed, etc. They would not be provided with the blue box on the right, which basically helps you work out roughly what the revenue potential is of the product. Okay. So maybe on this slide, in the interest of time, maybe just some words of wisdom. Well, that's assuming I'm wise, but little bits of advice. I suppose here is, you don't need to get things, it doesn't need to be exact, right? You can round numbers, right? There's, in these interviews, you're not given a calculator, right? Nor does the interviewer want to see you try and do long multiplication on a piece of paper. The idea is, let's get roughly a sense of it. So it's okay to round numbers. So if you get if you for some reason, for example, you know that the population of the US is 323,700,000, you don't need to go to that level of detail. You can say, okay, well, let's roughly say it's 300 million. Because the point of this is not to get, to test your ability to do bits of sums on paper, detailed, but rather, just check that you can do the kind of more simple maths and get things right and pay attention to detail. So simplification is good. Make simplifying assumptions if possible, but call them out to the interviewer. So, say things like, okay, well, let's assume that US population is 300 million. Go from there. And then just the other word of wisdom is, once you've got through to an answer, spend a minute or a few seconds just challenging yourself and sense checking it. If it doesn't feel right, if you've worked out the revenue potential for some product is in trillions or in thousands, then it's probably wrong, right? Because, so it's more like just sense check it, challenge yourself, and do this out loud. You can say this by, oh, look, let me just sense check that. Does that feel right? I suppose so. But also quality check the calculations you've done on your piece of paper, right? That's really important. Consulting is about accuracy. It's about clear thinking, accuracy, good communication, right? And so having that eye for detail and sort of healthy paranoia about quality is good. Yemi, anything else from your side?
No, I think you've covered it nicely. Yeah, just again, it's very important to vocalize your assumptions. If you're making any estimates, any assumptions, if there are gaps in your thinking, you should also call that out as well. So if you are calculating something and you don't know the answer to a particular piece of data that you need, also make that clear that you're leaving something out, but if you had it, you would have included it, things like that. So
yeah. Fabulous. Thank you. Oh, before we go on to the next question, can I just go back to slide 17? So actually, I think we forgot something. Whoops, my bad. So this question, at the top, it says, let's think about how you would go about calculating this opportunity size. But then it says, what types of information would you need to work this out, right? So that's where you might mention things like market research, right? Or epidemiology research, desk research, speaking to some payers, some experts, looking at competitor products to see how they're priced or what share they're realizing at the minute, right? Things like that. But let's not linger there. I think we've got 2 minutes, so I just want to give you a flavor of the next question. So having done the quantitative number on the prior slide, the next thing's about segmentation. So this is more about marketing, right? And so the interviewer would say, okay, right, great. So let's assume now we've done some market research and we've uncovered these different customer segments. Okay, which do you think would be more or less likely to prescribe Rheumatin? Right now, given the fact that we have not blessed with time at this moment, I think the key here on questions like this is about, again, it's about linking the information here on stuff you've seen before, right? So if you look back to slide 16, you'll remember that this product is more efficacious, right? Or so there's some other key facts about the market, right? And so then you get to this slide in 19, and it's about connecting the dots, right? That's just showing you're paying attention, you're understanding things. You can refer back to the other bits of paper, you can get them out in the room if you're doing things in person, that's fine. I think that's the key thing, is referring back.
Yeah.
All right, I think we're about to be dragged out of this meeting room. We don't need to go through this last one, there's not enough time to do it justice. I think maybe just some closing words. I mean, one is, oftentimes in case interviews, the designer of the interview constructs it such that it can't be done in time. So don't worry if you can't get everything done, right? So that's one thing. Take your time, get it right. All right, it's been a pleasure. Hope it's been useful for everybody.
Excellent.
All right, you guys only got to number 3. That means we win because we got to question 4. All right. So I think we're now handing over to you, right, Lucy, to give share a little bit on the interviewing process.
Yeah.
So Hamid, can you put up the slides? Okay, excellent. Thank you.
Thank you. In the interest of time, I will whiz through this, but I just want to let you know I am looking to run an event before our opening. So our jobs will open for 2023 on 22nd of August. And I will run a session before that, prior to that, just to kind of give you a bit more of an insight into the process, a little bit more about why you should apply to ZS as an associate or consultant, some perks that we have and why it's a really great place to work. So if you're interested to learn more, I'll follow up with an email after this event. But yes, Hamid, if we go to the next slide. So full-time associates and interns, it's a 1-round process. So you'll need to submit your CV to the ZS Careers portal, and there'll be 3 interviews. We usually try and run this as like an assessment centre day, and they work really well via Zoom, so likely it will still be via Zoom. So you'll have a behavioural interview. That's really just to see the value add of you joining us at ZS. So whether you could, work well in a team with us. The unstructured case, which we mentioned earlier, where you have no kind of materials or data and it's a question and you're asked to kind of structure that unstructured case, and a structured case interview similar to what we just went through there. The role of an associate and the intern. So associates typically are bachelor's, master's and PhD graduates, or recent grads studying one of those master's, bachelor's or PhD. The difference in terms of what you come in at, you will be a strategy, insights and planning associate. A slight difference between PhD and master and bachelor. With a PhD, you have a slightly higher salary, but that's it. You still come in the same level. As an associate, we kind of don't really expect you to know how to do the job. We give you really great training and we are here to support you. We just want you to be really enthusiastic, passionate, willing to learn. And in terms of the process, the interview process, we could really, really like you and love you. But if you're not very good at like case interviews, like if you don't kind of practice and know what a case is, so it's really great you attended today. A lot of the work that you are to do as an SIP associate is similar to the case interview. So we would want you to perform really well in the case interviews. And I can go into a bit more detail about that in the event that I run. Can we go to the next slide? And for full-time consultants and interns, so the interns for consultant level will be MBA. So studying at business school. Consultants typically have 5 to 8 years previous experience within a professional kind of environment. The role of a consultant and how that differs to an associate, you will kind of be managing the more junior levels within your project team. The structure of the interviews slightly longer, so you will have a 2-round process. So the first round will be a behavioural interview and a structured case, and then if successful you will then have a round 2. The round 2 is slightly longer, it's 2 hours, and again we try and run this as an assessment centre format. And then if you are offered a job, hopefully we run an info day, and that info day is just to really give you an insight into who we are, our culture, and if we're a place that you would like to join. I will hand over to Mary now.
Amazing. Thank you so much, Lucy. So hi, everyone. Great to see so many of you today. My name is Mary Ayola. I'm an associate consultant based in the London office. I joined ZS as an associate, so I've been here for a few years now. And I also head up the ZS Europe Black and Minority Ethnic society that we have here. So I just wanted to give you a quick overview of what we do, just a quick insight. So we kind of started this initiative to really celebrate and educate on all things Black, minority and ethnic. And across the years, we've held many events, including celebrating Black History Month. One of the things we did there was celebrated Black women in healthcare, for example. We've ran events in partnership with So Racism the Red Card, which for those of you based in the UK is a charitable organisation which is about stamping out racism. And also from the healthcare perspective, we have also conducted an event with the Sickle Cell Society to not only educate ourselves, but to also, you know, really support those that are disproportionately affected by sickle cell, which is the Black and the South Asian communities. So what you see on the screen here is that our overall mission is to really be conscious and build awareness about Black and minority ethnic, not only ZSs, as we like to call ourselves, but also our external community. So our 4 main pillars are that targeted recruiting. So really making sure we get the best talent from everywhere, right? Like regardless of your race, we're looking for the best talent, but that means we're really going out there and searching for it and not just making sure people come to us. Our second pillar is, as I mentioned, supporting external communities. So in the past, we've worked with loads of social enterprises and really given them our kind of pro bono consulting on their organizations. Internal awareness as well. So we host many different type of events. Last Black History Month, we had a DJ come in to educate us about the history of Black music, which was fascinating. And then also, like I said, celebrating Black History Month in its entirety. So we usually just have many different events there. So yes, I hope you have all found today incredibly useful. It is a bit of a snippet into what we do here at ZS in terms of how we approach our client problems, but also a bit of an insight into one of the focused ZS communities we have here, which is what you see on the slide now. And I'll hand back over to you, Lucy.
Thanks very much. So I think that was the last slide. I'm not sure. Yeah, I don't think we have time for Q&A now, which is really sad. But I would encourage you to connect with us on LinkedIn. And if you do have any questions, we are more than happy to answer them. And keep in touch. But thank you so much.